एंड वेलकम बैक। आप सुन रहे हैं जान है तो जहान है, आपका पसंदीदा प्रोग्राम। हम ले आते हैं हर इतवार को सुबह 10 बजे से दोपहर को 12 बजे तक। मैं हूं आपका होस्ट, आपका दोस्त, आपका प्राइमरी केयर फिजिशियन डॉक्टर अजय पाठक।
और मैं हूँ आपकी होस्टेस डॉक्टर आरती गुप्ता, आपकी किडनी स्पेशलिस्ट। और हमारे साथ आज बहुत सारे हाईली अकम्पलिश्ड लोग हैं। सो वी आर हैविंग अ वेरी गुड डिस्कशन अबाउट ऑटिज्म। सो अगर कोई भी लिसनर, if anybody wants to ask any questions, please do call us back. And our number is 214-817-3333. Please feel free to call because all of these doctors, dietitians and everybody is highly accomplished and able to answer any question that you have. और याद रखें, हमारा काम ज़िंदगी में यही है कि हम किसी तरीके से आप सबकी ज़िंदगी सुधार सकें। और not only do we do that on the radio to help you guys, we are also doing a lot of community service, free consultations, and that's where I was from 7:30 this morning till this radio show was almost 30 minutes in, and our goal is to improve public health. So
अच्छा गौरी जी, आप आपके बुक के बारे में बताइए। शी जस्ट पब्लिश्ड a brand new book, very accomplished physician locally.
So,
A primer on Ayurveda.
So the book actually I have co-authored with a fellow dietitian. Her name is Pushpa Sandarajan, and we have written this book called A Primer on Ayurveda. It's a practical guide on personalized nutrition for dietitians, nutritionists, and healthcare professionals. And this is meant for, again, healthcare professionals, the doctors, nutritionists, dietitians, any other healthcare professionals as well who want to know more about Ayurveda, and I also want to integrate Ayurveda into their practice. It's a really nice book to get your hands on about some of the concepts in Ayurveda and get introduced to Ayurveda. And this is available in Amazon, both in the paperback as well as the Kindle form.
और हमारा नंबर 214-817-3333, 214-817-3333। आप सुन रहे हैं जान है तो जहान है। What other developmental disorders kids suffer besides autism?
There's a huge list of neurodevelopmental or developmental disorders in general. I think we discussed earlier a little bit about ADHD. Just developmental delay is a huge neurodevelopmental disorder. It could be speech, social skills, gross motor skills, learning disabilities, which could be anywhere from dyslexia to dyscalculia to dysgraphia sometimes, writing difficulties. Intellectual disabilities is another huge, big spectrum of disorders, and the child could have a mild IQ disability to severely intellectually disabled. I would like to avoid the term mental retardation, which was used in the past.
Yes.
It just doesn't feel good to call your child mentally retarded, or as a physician saying that, hey, your child has mental retardation.
How many of us you think grew up with some kind of minor mental disorder and never realized?
Oh, that's a very good thing. I always keep thinking to myself, maybe I had ADHD as a child and never diagnosed. I think, especially with South Asian cultures, I think getting that label brings so much of a social stigma, and which we need to overcome. We just need to get over that. It's the help we are getting. It's not a label. Say if you don't get a label of ADHD, you don't get a separate classroom to get tested, or headphones, for example, you are probably having a high IQ, but you do well in poor in tests.
Or you get a little more time to finish your test.
Exactly. You get more, for example, for children with ADHD, it's not special ed. It's just that additional accommodation. You get a separate room for testing. You get visual aids. You get headphones. Maybe you get to do on a computer instead of a paper and pencil test. You just get that double the time than normal kids. And hey, you can be anywhere from great scientists to physicians to whatnot. So you just need that additional help, and without the diagnosis, you can't get it. And that's something we all universally have to come out of, that social stigma of getting labeled.
I'm so glad you mentioned that, because even last week we were talking about social stigma in our South Asian population. Anytime a child is diagnosed with any kind of intellectual or mental disorder, the family feels like this is a stigma, so we cannot mention it. But we need to, the adults, the parents need to grow emotionally and be able to accept their kid's diagnosis and help the kid. Hello, welcome to our show. Do you have a question for us? That's awesome. That's excellent. But are you seeing a pediatric neurologist for your son? Okay, so he does have another doctor too. That's good. I'm so glad you're taking good care of your son. And holistic medicine is always better. To try to basically encompass all the aspects of it and use our allopathic as well as Ayurvedic style of treating the disease. It's good, but I'm sure that you are constantly in consultation with his pediatric neurologist, who must have diagnosed him with his disorders, and make sure that the treatment that they're giving, you are using it. And of course, I'll let Dr. Shailaja Gola also talk about it, and let her give her input.
I'm glad he's doing very well, Mom, and great job to you.
This is 21.
And laughter therapy, awesome.
Thank you. आपके लिए a special message. Thank you, Safi साहब. Thank you. आपके लिए.
I have a mental challenge. Kid is 38. He was born with the umbilical cord and oxygen cephalopathy on his neck, so he's IQ of 40.
Yeah, I think that's the HIE probably which contributed.
Yeah,
Hypoxic.
mentally challenged, but he does everything. He got his own room, computers, but his fine motor skills are really not there.
I have a cousin too who had birth asphyxia, so was kind of very slowed down in his elementary school years. Now it's amazing how he's like 45 now, and he's completely functional, running a business, doing everything, while as a kid he was like a very underperforming kid. But certain things people are able to absorb, certain things they're not.
Yeah,
So
yeah.
he's at least he's got 2 kids, he's running his household, he's the one who's earning the income, he's doing everything.
Wow, so he's employed and working.
He's employed.
His own business.
Great, yeah, that's awesome.
So he gets
We were shocked, like when